back, you're Heather, or a parent with Alzheimer's, you're stuck in the situation. But how we deal with that situation, we have a lot more control over. So that's very empowering. So what we did is we said, well, if bad things can make your telomeres shorter, maybe good things can make them longer. And that's just what we found. We found the enzyme that's called telomerase, which she discovered and got the Nobel Prize for, is an enzyme that repairs and lengthens telomeres. And we found that went up by 30% in just 3 months. And over a 5-year period, we found that telomeres actually got longer by about 10% in the group that made these changes, whereas they got shorter in the control group. So the more diseases, and again, the more closely people follow the program, the more they change their lifestyle, the longer their telomeres got, again, at any age, which is a very empowering message. So our genes are a predisposition, but our genes are not our fate. And so often people say, oh, I've just got bad genes, what can I do? Well, it turns out you can do a lot. Again, not to blame, but to empower. And this is true for everyone. I've been working with President Clinton since 1993 when he took office, and Hillary Clinton asked me to train the chefs and cook for them at the White House and in Camp David and the Air Force One. And then when he'd have his annual physical exam at Bethesda Naval Hospital, I'd come in for that. And 8 years ago, when he had a bypass and it clogged up again, one of his cardiologists held a press conference on TV and said, oh, it was all in his genes and his diet and lifestyle had nothing to do with it. And having worked with him for so long, I knew it had everything to do with it. So I sent him an email and I said, look, the friends that I value the most are the ones who tell me what I need to hear, not what I want to hear. And you need to know that it's not all in your genes. But I say that not to blame you, but to empower you. Because if it's all in your genes, then you're a victim. You're not a victim. You're the most powerful guys on the planet. I figured I'll never hear from him again, or maybe I will. So a few days later, he asked to see me. I went to see him. And so he's been making these changes himself. And so whatever your politics are, when a former president, especially one who is known for not eating such a healthy diet, begins to change, I think that sets a really good example for everyone. But it's a very empowering realization to know that even if our mother and father and sister and brother and aunts and uncles all died prematurely from heart disease, it doesn't mean that we need to. We just need to make bigger changes to overcome that. And so, again, with all this talk about personalized medicine, it wasn't like there was one set of lifestyle changes for heart disease, a different one for diabetes or prostate cancer or whatever. It was the same for all of them. And I think the reason is that although we tend to think of these diseases as being very different from each other, I think actually they're different manifestations of very similar underlying processes like chronic inflammation and oxidative stress and telomeres and gene expression and what's called apoptosis, which is programmed cell death, and what's happening in your microbiome, the trillion of cells that are in your body that work together with you, and immune function and so on. And each one of these mechanisms is directly influenced by the diet and lifestyle choices that we make each day. So we did a couple of demonstration projects to see, people say, well, you live in California, it's an altered state, they'll do anything here, never play in Peoria. So through our nonprofit institute, we train hospitals and clinics around the country. And we showed bigger changes in lifestyle, better clinical outcomes, bigger cost savings, better adherence than anyone's ever shown. We did one study with Mutual of Omaha at 4 academic centers at Harvard, at Beth Israel, New York, at Scripps, and at UCSF, and 4 at community hospitals in Omaha, Des Moines, Columbia, South Carolina, where they told me gravy's a beverage, which it was, and Broward General Hospital in Fort Lauderdale. And most people, and these were all people who were told they needed to have a stent or a bypass, and they chose our program as a direct alternative, and almost 80% of them were able to avoid the surgery, and Mutual of Omaha found they saved almost $30,000 per patient in the first year. Highmark Blue Cross Blue Shield began covering and providing our program in 24 sites in West Virginia, Nebraska, and Pennsylvania. And West Virginia is #1 in heart disease the last 20 years. It's like Frank Sinatra used to sing, if I can make it in West Virginia, I can make it anywhere. And they found that they got these same outcomes, but they also found they cut their healthcare costs in half in the first year. They were the same at the beginning, and they were 50% lower in the first year, and they remained lower for at least 3 years. And so these approaches really save a lot of money. When they looked at the subgroup of people that they spent at least $25,000 on in the previous year, they saved 400%. So now that it saves money, many insurance companies and employers and others are interested in covering it because you don't have to wait years to see the benefit. If the people are really, the people they count, they cost them the most, you can actually show dramatic savings in the first year. And we've measured improvement in every metric at 12 weeks and again at 1 year. And a lot of doctors, probably most doctors, think, well, I can get my patients to take their Lipitor and their cholesterol-lowering drugs, but there's no way they're going to change their lifestyle. And yet, if you actually look at the pharmaceutical company's own data, half to 2/3 of people who are prescribed statin drugs to lower their cholesterol are not taking them just after 4 to 6 months. In fact, 20% never even filled a prescription. And yet we're getting 85 to 90% adherence to our program after a year. And then people say, well, that doesn't make any sense. How can that be? Because it's a lot harder to change your lifestyle than to take a pill. And we've learned what enables people to make sustainable changes. It's not fear of dying or fear of a heart attack, but joy and pleasure and love and freedom and feeling good. And those cholesterol-lowering drugs at best don't make you feel bad. They often make you feel worse. They can be life-saving if you have heart disease, but not if you don't take them. And yet we found that the reason people are willing to make these changes in lifestyle, even though it's quote harder than taking a pill, is because they're worth it. And what you gain is so much more than what you give up, and how quickly you can show improvements in those areas. And we're getting, like I say, 85 to 90% adherence at all of our sites after a year. And because, you know, if your chest pain, like in the first guy, Mel Leffer, if you're getting 30 episodes of chest pain a day, and you can't walk across the street before the light changes without getting pain, or you can't make love with your spouse, or play with your kids, or, you know, go back to work, you know, and within a few weeks you can do all those things, then people say things like, yeah, I like eating, you know, junk food, but not that much, because what I gain is so much more than what I give up, because these mechanisms are so dynamic. And the program is 9 weeks long, but you can see it from beginning to 9 weeks, in this case 12 weeks, to a year, a 19-pound weight loss. Angina shows striking reductions. Most people became pain-free in the first month. The ability to exercise goes up and stays up. You know, the old joke, am I going to live longer? Is it just going to seem longer? You know, it turns out that you have, you know, quality of life improves dramatically. Depression scores were cut almost in half. It actually works better than antidepressants. Systolic blood pressure shows sustained reductions, even though most people could reduce or get off their blood pressure pills. Diastolic blood pressure, same thing. Blood sugar comes down and stays down. Again, depression scores are almost cut in half. And then after, we trained over 50 sites through my nonprofit Preventive Medicine Research Institute. And again, we got these amazing outcomes, but some of the sites closed down, which was really depressing for me. And I was going like, why? They said, well, because it's not reimbursable. We don't have the money, it's follow the money. So they said, it doesn't matter how good it is clinically, it's not reimbursable, it's not sustainable. So that sent me on a 16-year journey to see if we could get Medicare to pay for it, because I figured if Medicare paid for it, most of the other insurance companies would. And if you change reimbursement, you change medical practice and even all the way back to medical education. I had no idea how hard it would be. So I met with the people at Medicare, and they said, oh, we can't pay for this because you know, everybody's got a crystal ball and pyramids when they have Medicare coverage. So I brought me the head of Mutual of Omaha, chief medical officer, and they said, we pay for this because it works. And then they said, well, no one will do it. I brought me the head of cardiology at Omaha, the first site we trained. He said, look, 90% of the people followed this well enough, they avoided the stent they would put in. They said, we're going to do it. We have the support of Bill Clinton when he was president, and Newt Gingrich when he was Speaker of the House, 20 members of the Senate, 30 members of the House from the most liberal Democrats and the most conservative Republicans. They all came together in this highly polarized political environment we live in. That was pretty unusual. It's even worse now, but even back then, you know, Bill Clinton and Newt Gingrich didn't get along about, didn't agree on very much, but they all came together around this. Even with that, it took 16 years to get coverage, but we got it. And so that was a real game changer. And so Medicare actually created a new benefit category to cover our program, and now most of the major insurance companies are paying for it as well, which makes it available to the people who most need it. I didn't want this just to be concierge medicine for people who are really affluent. I wanted it to be for everyone, and so now it is, which is great. And our approach is we train trainers. So we train a team of 6 people, a doctor, a nurse, what we call a stress management specialist, which is really a certified yoga meditation teacher. I mean, who would have thought Medicare would be paying for yoga, which is kind of cool. Exercise physiologist, a dietitian, and a psychologist. And we train the trainers. We actually have a training going up at the Embassy Suites today, where people come for 4 days and they go through the program like patients do, and they also get the didactic information. And when we offer this, we do it over a 9-week period. So people come for 4 hours at a time, twice a week for 9 weeks. So each time they come, they get an hour of exercise, an hour of meditation and yoga, an hour of a support group, and an hour of a group meal with a lecture. And after they finish their 9 weeks, then they continue to meet virtually using video conferencing called Zoom, which enables us to get such high levels of adherence. And because these underlying biological mechanisms are so dynamic, most people feel so much better so quickly, it reframes the reason for making lifestyle changes from fear of dying, which is not sustainable, to joy and pleasure and feeling good, which are. And just to show you an example of that, one of the sites we trained is at UCLA. This is a guy in the LAPD. Just after 9 weeks, you can see this 40 to 50% blockage became almost not there anymore. And it wasn't a spasm, it wasn't a blood clot, it was an actual lesion that regressed. I'm going to just get back to this in the interest of time. So we're now doing the first study to see if we can reverse Alzheimer's disease. And the reason why I think it's going to work is because I think we're at the same place with Alzheimer's that we were 40 years ago with heart disease. That there's every reason to think it'll work, but no one's actually done it. And the reason I think it'll work is that, first of all, it turns out a third of Alzheimer's cases they know are due to 7 modifiable risk factors: low education, high blood pressure, obesity, diabetes, physical inactivity, smoking, and depression. Now, one study showed that just walking a half hour a day makes your brain bigger. Now, that's another thing I was taught. Like you're born with a certain, when I was in medical school, you're born with a certain number of brain cells, and that's all you get. So if you go out and you have a couple 6-packs and you kill off a few thousand of them, you